Hello and welcome to the Public's Health Across the Life course.
What we really want is for everybody to have the healthiest, happiest life they possibly can, but there are challenges at different points in your life.
That's it.
The work of the health visitor often goes unseen. However, the work they do with children and families can in turn have a huge impact on outcomes of society.
We initially went to a couple for breastfeeding clinics as we were struggling with that at the start, and everybody there has been really professional, really helpful.
That age group is really important because it's when they're starting to take their life choices, they're becoming independent, and what they start to do now will shape the rest of their lives.
I've gained lots of confidence, I've learned how to eat well, and I'm just more fitter.
That's it, well done.
Counselling has made a huge difference to young people in the school, and some of the comments on the feedback forms have literally been, "This service has saved my life."
It was just such a relief to speak to somebody that I could just totally let go and tell them exactly how I was feeling.
We don't want to encourage or condone drug use, but we do want to help reduce drug-related harm on site.
If that's your thing, it's much better that you can find out whether what you're taking is the right thing and whether it's safe or not.
Just because you're a young person with a learning difficulty doesn't mean that, we have to make a job for you. We can fit them in to a job that's already there.
Do you like your job here?
Yes, it's quite fun for me.
People who are well and enjoy well-being in all its dimensions they're more engaged, they're more present, they're more productive, they're more innovative, they're more likely to stay, they're more likely to tell good stories about their experience at Rolls-Royce.
Our employees are quite rightly feeling more empowered to ask for more personalized benefits. The same benefits that help a young female employee are not the right ones for a middle-aged male employee.
A Better Medway is our way of integrating all of these services, support and information that people might need in order to help them make a healthier choice and improve their health and well-being in Medway.
It's good for our health, our joints, and we love it.
What we do need therefore is a clear message from our government, from the politicians and the NHS, to make it clear that vaping is endorsed.
Luckily, we just met the right person in one vape store, spent a bit of time with me, explained exactly what I needed, and that was it. That was a 40-a-day habit kicked.
Our research is really about keeping people out of hospital, and that's both health and social care.
As the evidence base is growing around the value of investing in preventative health services such as physical activity, there is much greater emphasis and investment in preventative health services.
Where you've got lots of people in the same environment, you've always got a potential issue with norovirus spreading. It's extremely contagious. Training and planning is absolutely critical.
A lot of our team may not have heard of it before, so it raises awareness about what it is and what to do.
We know that only 1 in 5 healthcare professionals currently monitor and capture data on the impact that they are having on the public's health, and we need to do more to support these healthcare professionals to do that.
It's about improving the health and well-being of the people in Northamptonshire, ensuring they can live in their own homes for longer, and keeping them out of the statutory health and social care sector. If we can avoid an older person having a fall, for example, they're not going into hospital, they may not need social care after that. And so there's also an economic argument for the things that we're doing.
Nature, in the form of bugs, are winning the battle against humans. We need more vaccines and better vaccine take-up. Vaccines make our lives livable.
And so we need to be sure that it's not just our children that we prioritise, it's people whenever vaccines are indicated throughout their life course.
Not only are we removing sort of high quantity calls from the NHS from non-emergency falls, we're also providing that wraparound prevention service so the falls won't happen again in the future.
I'm home on my own by choice. Nothing like it, is there?
The City of Manchester is bringing together health and social care at a scale that's never been done before.
We are involved in joint research projects, particularly around age-friendly neighbourhoods and community engagement, and we are working very closely with those organisations to ensure that their workforce is fit for purpose.
We have trained people to deliver prevention messages and prevention activities. They're also trained in physical education. So putting those two things together gives us a really powerful product.
I will keep doing the exercises because it has given me back my life. I was an old lady. I don't feel an old lady anymore.